So you're probably pretty worried by now because you discovered a brand new lesion on the head of the penis and it's red and it's kind of flat and it just appeared and it may bother you, meaning it may feel raw or it doesn't feel very pleasant to the touch, meaning the skin is compromised. And you're probably freaking out by now. You're thinking, well, this might be a sexually transmitted disease. Well, what you're probably dealing with is a condition called Zoon's Balanitis. And I want to talk to you about Zoon's Balanitis, give you all the ins and outs of this condition, which is actually a benign, non-infectious condition of the head of the penis. It's pretty common, so a lot of men experience it. And we're going to talk about Zoon's Balanitis, see what exactly you need to know about it, what are other possibilities that could look like Zoon's Balanitis, and ultimately we're going to send you to the dermatologist to take care of it with your head held up high and knowing exactly what to expect. So Zoon's Balanitis is a condition that is an inflammatory condition of the head of the penis. It is exclusively a condition of men who have their foreskin intact, men who have not been circumcised. And this condition is common in these men. I think about 1% of men experience it throughout their lives. And that can appear out of the blue on the head of the penis. It doesn't really require any pre-existing conditions. Most of the time, we don't really know what preempted that appearance of the Zoon's Balanitis, what started it in the first place. And all of a sudden, it just appears and it sticks around. It's something that is quite bothersome to the man when it shows up because, first of all, it is noticeable. It does show up as something that is clearly distinct on the head of the penis. It appears as this reddish, thin area on the head of the penis that can look to a lot of men instinctively like it's fungus or yeast infection. And we'll talk about that in a moment, but it is not a yeast infection. Zoon's Balanitis is an inflammatory condition, meaning the skin is worked up or irritated for some reason. We actually don't know what the cause is. This is an idiopathic condition. So you got to keep in mind that when you ask what exactly brought this on, you're not going to find too many answers. So you don't really need to look at your diet or your skincare, but we will talk about what to avoid in skincare to not make it worse. But it's certainly not, it's not an allergic reaction and it's not some sort of a response to any infectious organism. And most of the time, it is going to respond to treatment that is appropriate for inflammatory conditions. And we'll talk about that in a moment as well. So Zoon's Balanitis shows up out of the blue, and it looks like this red, thin plaque. And plaque means that the area on the skin, the texture is raised above the skin level, above the surface of the skin, and is distinct from the normal skin that surrounds the area that is affected. Unlike a patch, which is a flat area, meaning only discolored, and the texture of the skin appears actually quite normal. So Zoon's Balanitis is a thin plaque on the head of the penis in uncircumcised men, and it can be raw or irritated, meaning you may actually feel discomfort over the area. It's going to feel chafed or burning or maybe itchy, and that can send alarm signals for a lot of men. They're probably thinking, wow, this is a sexually transmitted disease. But it is not a sexually transmitted disease. It is not something that is transmitted by having sex with anyone or even coming in contact with anyone generally. It is a condition that starts up all by itself and just stays there. Now, the thing about Zoon's Balanitis, for most men instinctively, what they want to do is they want to roll their sleeves and start scrubbing away. A lot of people believe that this is a hygiene issue, meaning the skin over the head of the penis is not clean enough. Well, I'm here to tell you that that's actually quite the opposite. It's actually the opposite of a hygiene issue, meaning the skin is compromised. The skin barrier is compromised. So all the oils and the secretions and whatever makes up the skin barrier are actually deficient over areas that are inflamed, and specifically over areas that are affected with Zoon's Balanitis. And that means that the less you so-called clean, the better off you're going to be. And I know it sounds counterintuitive, but a lot of people tend to want to scrub the area, try to get the so-called infection away or out. This is not infectious. This is an irritation or an inflammation. So the more you scrub, the more you use hot water, strong streams of water, any sort of physical abrasive like a sponge or a loofah or a washcloth, or even a detergent like soap or cleansers, those are going to make the situation worse. And a lot of people instinctively want to reach for those and find it very difficult to believe that staying away from the area as far as cleansing is concerned is going to help this, but it will help this. It'll help this by not making the situation worse, meaning the skin barrier, which is already struggling under the inflammatory conditions of Zoon's balanitis, is not going to suffer as much if you actually back away from cleaning, take it very gently on the area, address the area gently by splashing maybe lukewarm water to cleanse it. You could use cold water as well, but do not use hot water. And do not use any disinfectants like alcohol or hydrogen peroxide or other disinfectants like chlorhexidine, which is called Hibiclens. Do not use those things because you're not dealing with a bacterial or a fungal infection. You are treating an inflammation of the skin. So the less you abrade, the less you cleanse and scrub the skin, the better off you're going to be. Moisturization actually goes a long way. Now, a lot of people don't realize this, but the foreskin itself provides a lot of ingredients to moisturize and lubricate the head of the penis. So that's what's going on underneath the foreskin. That's one of the functions of foreskin. And making up for the deficiency in skin barrier ingredients by applying a moisturizer like petroleum jelly or like our shea butter balm, which is called Butter Oasis Moisturizing Balm. Those can be very effective in lubricating the skin and occluding the skin to make sure that the skin is protected and soothed, and that can be very helpful just to make things a little better, just to take the edge off. Now, you do need to see a dermatologist to treat Zoon's balanitis. Why is that? Well, because Zoon's balanitis, interestingly enough, well, it is very common. It can look like other conditions, and it needs to be distinguished from those conditions so you're not treating the wrong condition by mistake and making your situation worse. Conditions that can look like Zoon's balanitis are candidiasis, which is an infection of the skin with candida, which is a form of yeast that can overgrow in numbers and can cause those red areas that are pretty irritated, red thin plaques that are pretty irritated. And another condition that can look quite like Zoon's balanitis is psoriasis and seborrheic dermatitis. Both of these need to be treated, sometimes very similarly to Zoon's balanitis, but you do want to make that distinction and make sure that you don't have either one of the two as well. Another less common condition that can look like Zoon's balanitis but is very serious is squamous cell carcinoma in situ of the head of the penis, which is called erythroplasia of Curat. And this is a very serious condition that definitely needs to be distinguished from Zoon's balanitis. So when you see the dermatologist, you will likely be asked to follow up with the dermatologist to make sure that your condition is improving with the appropriate treatment and is not sticking around despite that treatment, in which case there might be a need for further investigation and maybe a very different type of treatment. So what works for Zoon's balanitis? It is, as I said, it's an inflammatory condition of the skin, and that means that it usually responds to topical steroids. Topical steroids are the mainstay. They're the first line of treatment for the majority of inflammatory conditions of the skin. We're talking about conditions like eczema, psoriasis, seborrheic dermatitis. And a lot of these conditions respond pretty quickly within a matter of days or weeks. The head of the penis is pretty thin-skinned, so it will respond to topical treatment pretty quickly. Twice-a-day application of a topical steroid to the area with great skin care, not to undermine the skin barrier and make sure that you're not undoing your own work by scrubbing or cleaning the skin, making the skin barrier more compromised and undermining the skin barrier. So you do need to work hand in hand, no pun intended, with the topical medication, with the cream that the dermatologist would prescribe to you, and make sure that you're not making matters worse by doing your own thing at home, which a lot of people are tempted to do. So the other thing is to consider is that there are other medications which may work for Zoon's balanitis, specifically a medication category called calcineurin inhibitors, like tacrolimus or pimecrolimus. They're called Protopic and Elidel respectively, and those can help in clearing up Zoon's balanitis. There are other less tried and true medications that can work for Zoon's balanitis. A few case reports are medications like imicromod, for instance, that may work for Zoon's balanitis, but those are sort of like down the road medications in case your initial trial of topical steroids did not work. Now, the dermatologist is most likely going to ask you to follow up to make sure that the condition is actually improving as expected And this needs to be clarified. So how quickly does it take for Zoon's Balanitis to respond to treatment? Usually a few days to a few short weeks of consistent application of medication and great skincare are going to make Zoon's Balanitis much better, maybe even disappear completely. And mind you that Zoon's Balanitis is a chronic condition, meaning a lot of the times it comes and goes. So if you've cleared it up once, Zoon's Balanitis might come back and visit you again. But if you have a working solution and you know how to take great care of the skin of the area, you will be your own boss and you'll be able to address the symptoms as they come if they recur and you need to treat this again. And obviously Zoon's Balanitis is very disruptive to one's life. Obviously, it takes peace of mind away from you. It interferes with sexual function, obviously, because it makes things very unpleasant over the head of the penis and the foreskin. So it needs to be cleared, it needs to be controlled, and it needs to be kept away. And all that is going to be done by taking great care of your skin, not abrading it in the first place, not going pots and pans on your skin, not trying to cleanse it, not trying to disinfect it because you're not dealing with an infection. You're dealing with inflammation, which is very different. And the skin barrier is compromised under those conditions, which means that you may have to help things along with a topical moisturizer such as petroleum jelly or Butter Oasis Moisturizing Balm, our new Shea Butter Moisturizing Balm, along with topical medication, which may be required to control your condition. So follow up with your dermatologist at the intended time. Make sure that things are getting better. If they're not getting better, your dermatologist may require a biopsy. Some dermatologists actually, if they're not sure about the diagnosis, if it looks too much on the fence, they may actually do a biopsy right there and then and determine what condition you're suffering from. And that will determine and decide the course of treatment you're going to get. If you found this video helpful, please support the channel by clicking the like and subscribe button. Also, don't forget to share this video. For more information about genital skincare, pick up my book, Six Skin, Skincare Made Simple on Amazon.com. Now available in audio. Thanks for watching. God bless.